As pancreatic cancer is a silent cancer, most patients do not have much symptoms. So it is important or crucial to identify it early, hence there will be curative treatment for this particular disease. Hi, I'm Dr. Lee Chin Lee. I'm a senior consultant hepatobiliary and pancreatic surgeon at Gleneagles Hospital. My special interest is actually minimally invasive surgery for pancreatic and liver cancer. To identify pancreatic cancer, it is important to perform imaging, i.e. a CT scan or an MRI to diagnose the patient. However, for symptoms-wise, most patients present with very minimal or very vague symptoms such as upper abdominal discomfort, bloating, which mimics gastric discomfort, or weight loss and appetite loss. In patients with severe abdominal pain or back pain, the disease is usually quite advanced. Surgery is the only curative option for pancreatic cancer. The type of surgery depends on the location of the tumor. For patients with pancreatic tumor or cancer at the head and neck, Whipple's is the surgery of choice. Whipple surgery is a very complex multi-organ resection surgery, and it is performed either with an open method or minimally invasive method. Minimally invasive method can be laparoscopic or robotic. So Whipple surgery entails removal of few organs. Firstly, the duodenum, which is the first part of the small intestine. Subsequently, we will have to remove the pancreas at the head and at the neck, part of the bile duct, and also the gallbladder. After we remove the organs involved, we will have to join it in what we call a reconstruction phase, whereby there will be 3 sites of anastomosis. Anastomosis in medical term is called a joint for different organs. So firstly, we have to join the stomach, the bile duct, and the pancreas to the small intestine. The reconstruction phase varies depending on surgeon, but in general, it is this configuration. Pancreatic cancer is a very deadly cancer. I would advise most patients to seek medical attention even with the milder symptom.